With chronic kidney disease, a person suffers from gradual and usually permanent loss of kidney function over time. Dr. Rodolfo Batarsé of Desert Regional Medical Center in Palm Springs tells us what causes kidney disease.
Well, chronic kidney disease is a catchphrase that encompasses all types of diseases or medical conditions that affect the kidney and that diminish the kidney's function. By being chronic, it means that it's been there for more than 3 months and will likely continue to be there past the 3 months, most of the time for the rest of one's life. The kidneys are the unsung heroes, if you will. They go about their business, they do it silently, and most of us forget that they exist. And I think that's fantastic because that means that they're doing their job. But when they stop doing their job or they don't do their job as well as they should, then things and hints start to come up on blood tests and urine tests. Most of the time, however, patients don't realize they have the disease. And if they don't follow up with a primary physician, if they come to see us with symptoms, honestly, that means that the disease is quite advanced. All of us can get kidney disease. It does not discriminate with race or gender or age. There are certain ethnicities in the United States that are more likely to have chronic kidney disease. And those would be African Americans, Hispanic Americans, Native Americans. Proportionally have a higher risk and a higher incidence of chronic kidney disease, but everybody can potentially have kidney disease. Yes.
Can this disease be prevented?
The treatment for chronic kidney disease truly is one of prevention and management. The prevention has to revolve around the common reasons why people have kidney disease. Between diabetes and hypertension, that accounts for close to 70% of the kidney disease that's seen. Those are two diseases that are chronic, means they're there, once you have them, they're there for life, that require chronic treatment. And both of them, for the most part, are indolent. We wouldn't know we had them unless we check. Unless you go see a physician that checks blood pressure or that checks the fasting sugar and checks all the other parameters that need to be evaluated and managed. So truly, the treatment of the chronic kidney disease is to prevent it from progressing. Once it's diagnosed, if you're diabetic, the sugars need to be controlled. If you have hypertension, the blood pressure must be controlled.
Are there new treatments or a cure in the foreseeable future?
The new treatments and modalities revolve around continued proper and early diagnosis, revolves around education of both patients and physicians to diagnose it earlier and earlier, to catch the disease before long-term damage is done, and also different markers of kidney disease, not only from the blood, but from the urine, so we can both diagnose it earlier, have prognosticators saying which patients are more likely to progress faster or slower, and medications that address that. It's very exciting when you can actually have all these types of things, diet, medications, treatments with physicians, that can retard the disease enough where most patients can continue to lead a fairly healthy life.